Snow, and I'll be presenting about improving resident education on HIV PrEP. From 2018 to 2022, HIV prevalence in the U.S. is increasing at about 20,000 people per year. Campaigns from both the CDC and World Health Organization are working to lower the rates of new infection by 2030. As we know, HIV treatments have been endemic, so has medication for preventing HIV. Pre-exposure prophylaxis, also known as PrEP, is well studied and effective, and currently there are over 1 million people in the United States with an indication for PrEP. Only around a quarter of these people qualify actually have a prescription for the medication. In a family medicine clinic, patients regularly request testing for sexually transmitted infections or disclose behavior that qualifies for PrEP under guidelines. With this in mind, family medicine residents have an important opportunity to discuss and potentially prescribe PrEP with and for these patients. Our QI project focused on educating residents about the indications for PrEP, with the hope to increase consideration of prescribing these medications to patients by at least 10% 1 month after education. A pre-education survey was sent to residents and attendings about their familiarity with PrEP and their prescribing habits in the month preceding. During weekly didactics, a brief presentation was given about current USPSTF guidelines and indications for PrEP. These guidelines were also printed and available in resident workrooms in the clinics. A follow-up survey was sent approximately 1 month following education. Survey responses were used as data points for these prescribing habits. Prior to education, approximately 85% of residents who responded to the survey had not been considering using PrEP in their patient population. After resident education and in the month following, around 31% had considered it. So this was an increase of more than 10%, which was the goal of this QI project. Of note, there was limitations to the study in getting the same residents and attendings to answer both the pre-resident education and post-education surveys. Additionally, this is a small sample size. There were 20 respondents in the pre-education survey and 16 in the post-resident education survey. And this is all subjective data rather than objective data. Further projects could review the patient charts in order to see the actual both indications with STIs for PrEP therapy, history of IV drug use, or sexual practices in considering patient care and especially whole patient care in family medicine. We should work to taking thorough sexual histories to identify patients with indications for PrEP.